Good morning, Dr. Hare and fellow classmates. This is Tariana Michels here. Um, Today I will be sharing my key takeaways from the reading on human behavior and social environment, focusing on child development and the role of a social worker. Specifically, I'll address how the developmental stages from prenatal development to early childhood impact individuals and families. Let's start with Chapter 9, which covers hereditary prenatal development and birth. This chapter emphasizes the significance of both genetic inheritance and environmental factors during pregnancy. Hereditary plays a foundational role in shaping an individual's development, influencing everything from physical traits to predispositions for certain behaviors or conditions. Prenatal development involves three stages: the germinal stage, which are weeks 1 through 2. Fertilized eggs undergo cell division and implantation in the uterine wall. Embryonic, number 2 is embryonic stage, that's in weeks 3 to 8, where major organs and structures begin to form. And number 3, the fetal stage, which are weeks 9 through 40, further develop and growth of organs, muscles, and systems. We also learned about factors influencing prenatal development, which includes genetics, maternal health, environmental influences, and teratogens, which are harmful substances like drugs or alcohol. And then we learned about the birth, which is the process that includes labor, early, active, and transition phases, and delivery impacted by both biological and environmental factors. Moving on to Chapter 12, which discussed the psychosocial development in infancy and toddlerhood. We see how critical the early years for emotional and social development for a child can be. The key concept here is attachment theory. We learned about the trust and mistrust of Erican stage 1. The first psychosocial crisis occurs in infancy. Consistent caregiving helps infants develop trust, while neglect or inconsistency can lead into mistrust. We have the attachment, where the emotional bonds form between infants and caregivers, classified into two types of secure, avoidant, and ambivalent, and disorganized. We also have autonomy versus shame and doubt, which is also part of Erickson's stage 2. During toddlerhood, children begin to assert independence. Positive reinforcement leads to autonomy over critical caregivers may still instill shame and doubt. We had the social development, where babies begin to recognize themselves, develop social smiles, and engage in basic communications through gestures and sounds. And we also learned about the cognitive milestones. Infants begin to develop object preeminence, realizing that things exist even when not seen. Next, in chapter 13, we delve into the physical development in early childhood. This period is marked by rapid growth, especially in motor skills. So we learned in this chapter where growth patterns, children experience steady growth in height and in weight during childhood. Fine motor skills like drawing and gross motor skills like running become more refined. We also learned that brain development, the brain undergoes significant growth during this period. Synaptic connections increase, and I'm going to pronounce this wrong. Melanation enhances motor skills and cognitive abilities. Sleep patterns, quality of sleep is crucial for the brain's development and physical health. Sleep needs sleep needs change as children grow, with preschoolers needing about 10 to 13 hours. We also learned about the health and nutrition. Proper nutrition supports physical growth and development. Development, malnutrition, or excessive food intake can have lasting impacts. And we also learned about motor skills development, where in early childhood it is critical period for developing both fine motor skills like using utensils and gross motor skills like walking and climbing. We go into now chapter 14, where we focus on the cognitive development during early childhood. This period is marked by Piaget's pre-operational stage, where children start to develop symbolic thinking but struggle with logic. So the Piaget's uh, pre-operational stage in ages 2 to 7, we learned that children are egocentric and engaging in symbolic play, pretend playing, using some objects to represent another. Um, they struggle with logical operations and conversations, but understanding that quantity doesn't change despite the appearance. We also learned that language development, rapid language acquisition occurs during early childhood. Children begin to use more complex sentences and explain their vocabulary significantly. We learned about theory of mind, which is by age 3 and 4. Children start to understand that others have thoughts, feelings, and perspectives from different from their own. Vygotsky's social culture theory, cognitive development is shaped by social interactions. Language is a key tool for learning, and children often learn through guided participation and scaffolding. Executive functioning, early childhood is when children begin developing the ability to focus attention, control impulses, and manage emotions. Going into chapter 15, we dive into psychosocial development in early childhood, which is all about a child's ability to develop independence and engage socially. So we have initiative versus guilt, which is also part of Erickson's stage 3, where children develop a sense of initiative by exploring and making decisions. If discouraged or overly controlled, they may feel guilt. Self-concept. Preschoolers start to develop a sense of who they are based on their abilities, preferences, and social interactions. Moral development. Children begin to understanding right from wrong, influenced by parental guidance and culture norms. Social relationships, peers, interactions become more as children begin to engage in cooperative play and develop friendships. Gender identity. By the age of 3, children start identifying with gender roles and norms. Gender identity is influenced by social cues and interactions with caregivers. In emotional development, children learn to manage and express their emotions, especially through social interactions and modeling behaviors of adults. These 5 chapters collectively emphasize the interconnectedness of development, how physical, cognitive, and psychosocial changes all influence one another. Hereditary and prenatal factors lay the foundation, while early childhood stages focus on development of trust, autonomy, motor skills, cognitive abilities, and emotional regulation. Understanding how these domains interact allows us to appreciate the complexity of human growth and behavior in a social environment. Also, by understanding these developmental stages from prenatal care to early childhood, we can provide vital assistance helping families navigate challenges and promoting healthy development for children in their care. It's about being proactive and supportive, ensuring that every child gets the best start in life.